Today I will take the first part is the introduction of growth and development. What is the growth and what is the development? Anyone can say what is Khalid? Khalid, is there Khalid?
Yes, sir.
What is the growth and what is the development?
Physical and mentality maturity of children is called growth and development.
No, growth and development is same word or different word? I'm asking you.
Sorry, sir.
It's
Some
okay.
confusion.
Yeah, no problem. Growth and development, when always using together this word, but growth and development has a different meaning. So growth and development, it is a not a synonymous word. It is a different word. So we see what is growth. Growth
Sir,
is a
different, sir.
yeah, no, it's okay, no problem. Huh? And what is the growth? Growth is nothing. Just we have see the physical measurement. Growth can be measured by the quantitatively you can measure. Either it is a growth physical. You mute it, Khalid. You mute your mic, okay? And development it can be see here there is a skills.
So growth is quantitative sense.
I will come. Okay. I will come. Now, who is? Don't mute it. Okay. After.
Manish sir, good morning. Just I connected.
No, actually,
Just I
madam,
connected.
yeah, that's good, madam. Actually, these people are ID confused. So I was waited as a student only showing two students are. I mean, two people joined. After I just inquired, then the ID they put different. That's why student is not.
I also was trying to complete. I couldn't connect it. Now only I got connected.
Yeah, I came right time only here. So I just these people just confused with ID. Then again they called. Then they confirmed. They have given college ID, that is different ID, and there that person who came here just on that different ID he put. That's I mean confused. That's only.
Okay. So mobile also I can connect it from here. It's okay, no problem. I think so.
Madam, might be. Huh?
Okay. Okay, carry on.
Yeah. Okay. Huh? Okay. Yeah. So here we'll see growth and development. So I will see definition here. What is the growth and what is the development? Separately, I made slide. So according to that, we can discuss. Growth is a increasing in physical size of the whole body or any its parts. Okay. So nothing. Growth is an increase in physical size. It means we can always use to measure the growth in quantitative. Quantitatively, we can measure. What is quantitative and qualitative? Anyone can say what is quantitative? Ms. Smith, what is quantitative? What is the qualitative? Yes. Yeah, what is the quantitative?
Sir, quantity means that is in number form, and qualitative means that is in quality, means any characteristic features.
Yeah, very good. So it's a quantity numerically we can measure. So we can measure numerically. So we can, for example, the height can be measured by the centimeter, meter, and similarly for weight we can measure by the kg and grams, pounds. So these are the measurement. So that growth can be measured by the quantitatively, and development can measure by the qualitative. So you can write this word whenever they ask the definition. What is the growth? Growth is referred to the increase the physical size of the whole body or its parts. So it can be measured by quantitatively. It can be measured, and for example, weight in kg and height in centimeter. Like that you have to write. Then only you will get a mass. This is very important, and you can use whatever terms exactly that term should be used. Okay. So it can be measured through the sorry, this one. Okay. Similarly, what is development? Development is referred to the progressive increase the skill and capacity of the function. So what Sumit is told, that is right. Development can be measured by observation and checklist, or give some exams like that is skill and capacity of function. For example, you are conducting your practical skills, any ASCII test or other can give something procedure to you, how you are doing procedure, that is come under the development skills. Okay. So it will be measured by the observation. We can measure this one by observation. So like we can observe the checklist through checklist. Checklist means already you studied bed making. For example, bed making, I will ask after the second year, I will ask how to do the bed making. Then I will, all the students I will call individually, personally I will call, and I will ask them to do the bed making. I will stand beside of you. I will check how you are doing bed making. Either it is appropriate way, either it is not following the procedure. So this is a development. If you are following the appropriate way, you can give the your skills are up to level. If you not follow the instruction, you will not follow the proper practical skills, I will poor performance. I will. That's why development, it is a little bit bias maybe happen. What is bias means? Maybe sometimes I did not observe properly. I know that the before that student is very brilliant. Maybe that's why he is not able to do. Sometimes I will give some excuse. That is a bias maybe happen. But growth measurement is accurate, can be measured, because numerical value is always give the accurate result, and it is appropriately we can be measured exactly what it is. Okay, so development, it is a sometimes it is maybe variation is there, but every time it is not variation, but we can be managed very strictly. We can be managed. For example, you are already students who are brilliant, who are not studying, who are very punctually. So according to that, my mind is already set. Some whenever I do observation, might be sometimes the students are okay, is doing better, but this time is not able. But that's why whenever you come to the exams, final exams and other exams, other person will come. Other person means other than who are teach already, that person along with another person will come, then he is evaluating your development skill. Getting my point? No?
Yes, sir.
Yes,
Yeah, that is the main difference in development. Development, you can be measure the skills and functions. So don't confuse with the growth is a different word and development is a different word. So it is a synonymously, it can be coordinate each other and you can grow up. That's the normal life process. Okay. It can be measured through the observation and you can do so. Okay, that is already explained. So the babies are 5 babies different, they have, you can't say that all the babies have a same characters. Sometimes there is many factors may influencing. I will tell you what are the factors are influencing the growth and development, and you can come to know. Okay, what is maturation? Maturation is the same thing. Okay, uh, maturation is a increase the child competency and adaptability. So development and maturation is a similar word. So here we can be competition. Maturation means some person is already can be very accountability for his work. He's always maturely, he is very good in his skills developed. You can see that is also same. We can observation we can do, and we can measure the maturation. Okay, so it is described in qualitative changes in the structure. Same, it is a development how it is measuring qualitatively. Maturation also you can measure in the qualitative. For example, if you given problem, so school age children, 6 to 12 years baby children, we can give some problem task, we can give that problem in the sense mathematically he can be very good observer and very critical thinker in 6 to 12 years age children. That's why I give some according to his age group some problem. If he solve that problem, it means he's very goodly mature. And some I will give some task, I will ask him to do, and he will critically think and he will do those things. That is called the maturation. Okay, so person is very matured because he can be understanding the he's manipulate the environment. He's master of his environment, and he can be adapting to the society. He can easily solve his own problem and he can be guide to the others. That is called as a maturation. Maturation is a qualitatively you can measure. So you already studied in psychology, just I'm repeating this. That one more thing is very important. The level of maturation depends on the child heredity. So I told you heredity factor is one of the major factor for growth and development. For example, if suppose child is very high IQ, because of their parents also sometimes is influencing. The parents are very good in IQ level, that child also might be, most of the children are have a more IQ. So this is one of the reason. So this maturation also mainly depend on hereditary factor, means genetically it may be help. Okay, fine, good. This is, I will ask some question to students. Sabah, Why is importance of growth and development for nurses is not there? Huh? See some.
Yes, sir.
Wait. So, what? Why is the growth and development is important for nursing? What is the reason behind of this?
To treat the child patient.
Yeah. Yeah. Right. You tell me. Yeah. So what are the just you specifically you can say no? What? Why is it important? What is the reason behind of this? Is it important for nurses? Because why is there included pediatric in your subject as your subject? What is the reason of this? What is behind of rational? What is this? Sabha, no. Who will tell? Who will tell? Yeah,
Sir, to diagnose the disease like in children malnutrition, not
yeah,
uh,
yeah,
physically, mentally.
yeah, yeah. That's true. Then,
Sir, to check cognitive ability.
yeah, exactly. Because we see the cognitive ability. Because if you are 4 5 years child, you ask him to you give something in a box, something you go box. You can ask him to organize this box. Then the child will start with the critical thinking and cognitive development. We can assist. Suppose school age children also we can check. There are many things we can check how to do these all things. Okay, the fine. I will tell you what are the importance of this growth and development for nursing professional. Knowing what to expect of the particular child at any given age. It means you know that what is exactly the child is known, how to he handle the child, and what are the expected. For example, if suppose 2.5 years baby came to hospital. Okay, this is a tertiary unit hospital. The doctors are 24 hours as available. They can assist the child. Suppose you are after completing your course, you got job in some peripheral level, community level, or PhD level. Suppose any patient or a child is parents that took the child, it's around 2.5 years child took to the you, then you know that by seeing the child and you can measure the vital signs and you measure the height and weight and performance measurement, you come to know what is the expected weight of this child. Suppose you don't know the pediatric, then it is very difficult to assess. For example, 2.5 kg, I mean 2.5 years children came to you, then you can know that is approximately child weight will be 10 to 14 kg or 15 kg. So 14 kg up to we can consider 12 to 14 kg. If child is weight less than 9, less than 4, so it is a very difficult. Okay, so that we can very clear, we need to understand what is the expected weight. For example, 4 years babies came to you and they are you checking the anthropometry measurement and growth chart, you come to know that child is a height is less than 80 or 70. It means a child is not up to mark what are expected in height according to his age. 4 year child approximately is a 100 centimeter. Okay, so it should be very well known before that, then only you can manage to the children. Okay, this is very important. Okay, next we'll see what is next point, gaining better understanding of the reason behind of illness. Suppose for example, if you are very well known and you know the all the aspect of the growth and development, it can easily diagnose, because nursing diagnosis also is a very skillful task to the nurses. Okay, don't think about only doctors are diagnosed and they will start treatment. You also diagnose, because you are nursing aspect, you diagnose. That's why your care plan you are writing nursing diagnosis. What is the reason of that? We have some rationale on that, no? So that I'm telling you, so you can assist the child accordingly and you can start the treatment. It is very important. Okay, so how you understand, for example, the child is came to you and 1 year child is came to you and he then you know that the child is not, parents are telling child has not passed the urine since 12 hours and child is looking very dull and child is no tears and skin is very turgid. Then you come to know these all things. Then you come to know, you suddenly you can start the oral feed, or otherwise you can ORS you can prepare and you can give the ORS to the parents or educate the parents to start the ORS. If child is not able to and continuously vomiting and ask the child to take the PHC or a CHC referral center for the IV fluids, because we need to improve the IV fluid, because hydration is one of the major factor for the children's. So children can't tolerate the hydration. So we need to immediate replacement of the fluid, what are the fluid loss. Okay, these things should be very clear, I'm telling you. So you people, so first you can thoroughly know the growth and development, then only you can understand the other aspect of the pediatric. So many times I asked whoever, even many times I went as an examiner, and the examiner came to here, they ask growth and development related questions. Okay, so suppose you are, the examiner came to you and you tell what is the age of child. So you tell a 1 year child, and what is the expected weight of the 1 year child. So suddenly you have to answer that question, is it? So these are the very important things. Sometimes it's very difficult to answer you people. So that's why you know what is the expected weight according to the age, according to the child condition, you can be diagnosed. It is gaining the better understanding of the reason behind illness means students are, if you know very well growth and development, you know very well growth and development, you can easily diagnose the nursing problems. Okay. Similarly, next you see helping the formulating the plan. Once you exactly diagnose the problem, I told you, suppose child is came with the problem with the child. Suppose you are working as a staff nurse in a any community health center or any PHC. So child has a, parents have took the child, took the child 1 year child to you, and they are telling the complaints like the child is not passed the urine since 12 hours, and child is look very dull, and child tears is not come, and child skin is very turgid. Then you come to know child has a severe dehydration. So suddenly we make the formulate the plan what will do, just to prepare the ORS, and you just ask the child to drink. Suppose child is not able to drink, then you can report to the child for higher center. This is very important. This is a nursing task. Okay, so every time the doctors come and treat, sometimes the nursing person is the main person to approach the by parents. So if you accurately diagnose the parents, I mean child, then definitely we can save the child. So it is very important. That's why I'm telling you, very carefully read the growth and development. Don't neglect. Okay, helping the parents education in order to achieve the optimal growth and development at each stage. Okay, so you very well know what is the expected weight and what is the expected height of the child according to the stages. I told you yesterday what are the stages of growth and development. So there are infant, toddler, preschool, school age, and adolescence. So according to that, you know that suppose infant hai to you have to do it. You have to ask the parents. You have to very take care of on breastfeeding. First 6 months, you ask the parents should not be give other than breastfeeding. Then weaning you start. How you start the weaning? What are the food you will start initiate? What are the protein derivatives food? Everything you can be explained to the parents, because of the you know very good in the stages of growth and development. You know very well knowledge and beyond of your knowledge, it will help to teach the parents. So yesterday last class I just discussed, when growth and development, when you come to the pediatric, you not give the directly teach to the child is not able to understand. Adolescence age group, okay, they can understand, but to toddler school age and preschool age, they're very difficult to understand. So the time you can explain to the parents or who are giving care to the children. Okay, fine. And what are the principle of growth and development? Already we discussed this. Already yesterday I given some hints. So growth and development is a continued process. Okay, because a continued process. Once growth is up to level, and then development is a continued process. Growth is adolescence, adult it is stop. Then development it is because daily we can learn the new skill. And today you people also learn, even 60 years person also learn the many things, because now technology is came. So they are not studied in technology now, or they are learning in a technology. That is also called the development. Development is a continued process throughout the life, and growth it is a optimum level. It will go reach, and height will be stopped. Suppose after a secondary sexual character is developed, up to 18 years or 21 years, child growth will be stopped. Then development will not be stopped. It is continued process. And predictable sequence. What is predictable sequence? What you understood this meaning? Deepti Singh, what is predictable sequence? What will tell? What is the why they are predictable sequence they written? Deepti is there?
Sir, because it is decided that at what age, sir, there
Yeah.
is level.
Yeah, good, good, good. Yeah, that is predictable means we know that child is first to start the sitting. Okay, पहला बच्चा बैठने के लिए सीखता है, then बच्चा खड़ा होता है. Is it same thing? Predictable. We know that 6 month or 7 month child is start to sitting, and then 1 year or 12 or 13 months child is start with the support standing. And after standing, the child will start the move one step or two steps around 14 months. Okay, so then gradually up to 2 years child is can independently walk for a few steps or more steps. Okay, this is a predictable sequence. And one more example I will give. In this the child is I will tell you next what are the development will come, the gross development, fine motor development I will take next class. I will tell you. So predictable means there is some predictable means you can be first to this month this years this only develop the next for 1 year baby it's developing these things. Okay, this is a predictable sequence. And don't progress at the same rate. What is this meaning? See, it's a very important point. Don't progress at the same rate. Increase the see. Sometimes I'm telling you, the child is a first 6 month is very fast growth and development take place, and next toddler age and preschool age child is sustainably developing. Again, it is a school age and adolescence child is very fast growth and development. It means a child is a sometimes is the first 6 months. See, after birth child within 6 months baby start with sitting. It means how much the child is growing, it's very fast. And in you see that when the child is in adolescence age 12 or 11 12 years, from 11 12 years up to 18 years they are rapid growth and development. So that's why we know that the principle of growth and development, it is saying that growth and development is some particular age it is very fast, and some years it is it come very slow, then after that it is fast, like that. Okay, so I will tell you next when I came to the preschool and toddler, I will tell you how it is what is expected weight, what is expected height will increase. Okay, so next you will see not all body parts grown in same rate at the same time. Can you give example of this point? Who will give? Ambika. Not all body parts are grow in the same rate at the same time. I will note it. Those students are not responding, I will note. Okay, I will not give attendance. Tell them. If the network issue means it's your side problem. I told you yesterday, where you get very good signal, you come there and you spend for at least 3 to 4 hours whenever class is there, because our side is very clear, we are getting very good network here, and if my side is in problem means let me know, I will make correction. But your side is problem means I can't do anything. Okay, so not all body parts grow in the same rate at the same time. It means for example brain is growth and development take place within 2 years completely, as compared to adult 90% of growth and development take place brain within the 2 years of the child. It means brain is growth is very fast comparatively other system. For example another example I will give, and that endocrine system, endocrine development, it is very fast in the first 8 years of the child. 8 years of the child, it is a very fast, it is reached to the peak level, and it start with the down. It means some body parts are growing very fast. For example, another example I will give, and ovary and for females and testis development is take place in during the adolescence, when the child is a secondary sexual character is affair, that time we can see. Okay, so these are the things we can very clear, we can be make sure that which part of the body is growing in the which age group, and how it is a infant and child. These are the we can be see. Okay, and one more thing
Can
one
we compare the development of hands and hairs? Like for a certain age, our hands and legs also develop, but our hairs are continuously growing throughout our life, and nails. Can they be compared?
no, that is not that hair pulse you are telling hairs and other body parts
Yes, sir.
No, that is you can't predict. That is here's I'm telling systematically that here's might be some individual difference also, some hereditary factors also influencing. Sometimes their parents they have any history of that here is came late. So that is also that you can't say. Some I told you that the growth and development is not only depend on the hereditary. It may be depend on other environmental factors. I will tell you what are the factors influencing the growth and development. Okay. So while you come to know, clear?
Okay, sir.
Yeah, I will come. Next slide is there. Following slide, I
Sir,
will
it
show you.
also,
Yeah,
sir, sir, it also depends on the genetic factor. This sometime it's seen that if the
yeah,
if
yeah.
we see that the development of the her mother or his mother and father was late, then their child was also
Yeah,
the
that's
late.
only I told you. I told you before only. So some children are having some fathers in. And one more thing, I will tell you. Some menstrual cycle I'm speaking. Some mothers have history of the late menstrual cycle. Menarche is late. Usually is 13 to 14 years menarche. But what is menarche? Vivek Singh. What menarche means first menstrual cycle. So the time mothers have a history of the late
So
menarche
it is
makes
first
the,
menstrual cycle.
yeah, yeah, that children might be that who are the children of that mother, that maybe that children maybe it can be expected for the late menarche, is it? That is a hereditary. Even you are here also, here sometimes maybe it is a influencing the hereditary. Okay, you can't say only hereditary, some other factors also we can say. Okay. Yeah, then each child grow in his her own unique way. So I told you sometimes hereditary is a major factor. Suppose parents are very strong and they are physically very fit, that time his growth and development is a very, you can all stay, all the people are very power means very same strength will not growth and development take place. Maybe sometimes hereditary and parental characteristic also influencing for the growth and development. Okay, I will show you what are the factors affecting growth and development in next slide. I hope you should understood what is the principle of growth and development. Okay, so next I will tell you the growth and development is regular. Okay, and direction, cephalocaudal direction. Yesterday I told you what is cephalocaudal. Tell me what is the cephalocaudal. Yesterday I discussed this point. Okay, what is cephalo? Hmm?
Sir,
Sir, head to toe.
Yeah, head to toe. First head is already I told you. Cephalon means head. Already head I told. Head is a very fast growth and development take place within 2 years of the child age. The head is increase. It is size and it is capability. Functioning is increase. And after that, so that's why child head is from head side to develop. Then it's come to the down. Okay, this is a cephalocaudal. And what is the next? Proximo distal. What is proximo distal? Proximo distal. Yeah.
Translate the body to the peripheral.
Yeah. First you start with the central and you go to the peripheral. For example, child is start with the sitting position. After child is start with the walk and stand. Is it means central means child is start with sitting, and meanwhile after 4-5 months child is start with the stand. After standing position child will start with the walk. Okay, that is a like that central to peripheral and cephalocaudal. This is it is a regular related direction of the growth and development. These things you should be mentioned here. But general to specific. How general to specific? For example, if I give some pen to the to 1.5 year pen baby, if I give my pen to him, then he take the he hold the pen like that. Like this is a grossly he told. If I give that child in 4-5 years child, he will start with a specifically hold the pen in by fingers he hold the pen. It means general to specific. It is first gross motor development. After that it is come to the motor fine motor development. It means general to specific. I will tell you what is gross motor or what is the fine motor in next when I come to the your growth and development in a specific case. Okay, this is a growth development. First central it will take, then after go to the peripheral. Showing this diagram. Karthik Arya, your voice is not clear like that. Is any problem with my voice? सबको audible है?
Yes,
I'm
sir.
audible. Huh? See, Karthik, that is not my problem. Maybe your network issue. Okay. You go, come where you get the good network, then you come there. I think you'll get. Okay. So next growth pattern already we discussed. The the patterns of the growth is in the head to toe and direction. Already I discussed this slide. So I'm not going to focus on this. So what is the problem exactly? It's not get my voice. Clear voice is how many students are not getting my clear voice? Huh?
Yes, sir.
No, voice is clear or what?
Sir, your voice is clear.
Then some students are messaging. Okay. See, this is your side problem. I'm telling you because I getting good network here.
Sir, actually, this is the glitches of the sometimes glitches app glitches because the video is perfectly running. Via sometimes your voice disconnect and then voice come. This is the app problem. This is not an internet issue.
Okay, just to
Some bugs in
just to getting slides means okay, fine, no issue. We just to see through it. I mean, through it the slides. And is there any? If not get it, just to let me know after you just send me message, and we'll discuss. And one more thing, if you want to more details, just to go through it books in books already written, whatever already taken this slide from the books only. If you want further information, you just to go through it the books. And if you not get, then just ask me. Okay, this can be do. So okay, I think only few students have some problems, so just to listen. Okay, and you try to make where you get the good signal you come, then application forward. I mean, this problem with application I can't do anything. But is a network your side means your side should be clear. That's only. Okay, what are the factors? What are the factors affecting the growth and development? So here so many times they will ask long essay on this. Okay, you don't confuse with this. And long essay might be 15 marks. They will ask what is the growth and development and what are the factors affecting growth and development. So you know what is the hereditary factors, what are the environmental factors. So growth and development is not only the depend on the only specific problem. You can't rule out that because of this only the child is having problem. We can be look at the all the areas. For example, suppose child has some congenital malformation. So some congenital malformation, there is not accurate reason. They till 50% is unknown reason. Okay, so that I'm telling you. So we can just rule out. We can be we can say this is the reason most of the cases will get the infected. Okay, that is maybe hereditary, maybe environmental, but maximum 50% of the problems it is unknown reason. Okay. Okay, next prenatal environment. What is the prenatal environment? Factor related to the mother during pregnancy. See, I told you that the growth and development it is start from the inside the fetus, inside the uterus. So from then when the baby concept start the embryo, then you already studied in psychology. I mean physiology. What is the zygote? What is the embryo? What is the fetus? Okay, what is the fetus? How many months we call the fetus? When you call the fetus up to how many months?
Sir, up to first trimester we are calling fetus.
Oh, sorry,
Sir,
up to
up to first trimester we can call the fetus. Means 28 days.
that is wrong. Then who will tell exact answer? What is
No.
fetus? No, no, that's wrong. What is fetus?
More than 8 weeks after conception means unborn or unhatched offspring.
Okay, more than.
8 week, 8 weeks after conceptions.
So what is the before 8 week? What we call?
Sir, means till 8 week we call.
That is only. Okay. Your answer is accurate. That is exactly I'm accepting that. I'm agree with you. So after
Embryo we call.
yeah, very good. Embryo. Okay. After zygote, we call the embryo. Up to 8 weeks, that is called the embryo. And after 8 weeks to till delivery, we call the fetus. Clear? Okay, fine. So then what will next to see the what are the factors like nutritional deficiency. So that's why during pregnancy doctors are giving supplementary iron, and they will ask the extra calories and the extra uh, protein derivatives and carbohydrates, calcium, iron. Why they are giving means we need extra, because the mother is gaining the weight, mother is carrying the another life. It means another embryo or fetus they are carrying, because the mother herself as the, and that baby also need the feed the baby. That's why you need more food to the pregnancy mother. That's why antenatal checkup doctors are giving, the government is giving the folic acid and iron tablets and supplementary food. At least 300 kilocalorie the mother should be take during the pregnancy. Per day she is a 300 kilocalorie she is required additional food for a pregnant mother. Okay, so another things we see, there are diabetic mother also. Suppose that mother is not take the adequate food, maybe that child is not growth and development take place in the fetus, in the uterus. And diabetic mother also we see, mother is required continuously can be see the mothers of diabetic. You already studied what is diabetes. Diabetic, gestational diabetic mellitus, it is the most common problem. So when during the pregnancy the mother have a problem with diabetic problem, so mother having gestational diabetic, that might be the child is not get the adequate glucose. So that's why the child has a showing the macrosomia, means the child size is increasing. So this is very difficult. Maybe child is go up to hypoglycemia, hyperglycemia. So you have to regularly consult a doctor, a gynecologist, and you can take the follow-up. Diabetic mellitus of mother also during pregnancy may cause to the impact on the child and growth and development. Okay. And next is the exposure to the radiation. So that's why always doctors are saying who are the mother is pregnant, they are not allowed to read X-ray room, or they will not allow CT and all this, because it definitely major impact. First trimester, what is first trimester? How many months we call the first trimester?
3 months. 3 months.
Yeah, first 3 months. Okay, that is the first trimester. First trimester it is more confused, because the mother also confused, she is not pregnant. Even other people also they are not ruled out she is pregnant. That time might be she is exposing to the radiation. Okay, so that's why, so X-ray, because first 3 months there is a one हिंदवासिनी बंद करो आपका म्यूट करो म्यूट whenever ask question just to answer, then after that you mute it please. Okay, so exposed to the radiation is one of the major problem. So first trimester, first 3 months, because most of the organ is development take place in first 3 months of the baby and fetus. So if suppose an embryo stage is very important. First 2 or 3 months is very important, because maximum all the organs are developed, or all the formation is take place in within 2 to 3 months. If suppose during this period if can expose this unnecessary drugs and radiation, definitely it will harm to the baby. So that's why we can be very careful on this. And next we see infection with the German measles. So it is also we can see German measles. It is one of the that is what is the other name of German measles? What is the other name of German measles? Already communicated. Ambika, is there Ambika? And still some students I know who are not answering my questions. I will not give attendance for them. Okay, don't worry about it. Yeah, rubella we can solve the German measles. So here what will happen? So it is one of the first trimester. If you have infection, I mean, definitely it is major organ malformation, especially cardiac and genitourinary malformation is common. So you have to rule out. So in German measles, rubella, so you have to terminate. The most of the gynecologists or doctors are suggesting so should be terminate the pregnancy, because it is a 90% of cases maybe some major organ malformation. Okay, so that's why. And even rubella vaccines, after vaccines also once infected, at least 6 or 1 year pregnancy may be postponed, because that the vaccine, live vaccine, maybe it is harm to the baby. So that's why this is everything. So whenever you go to the antenatal visit, that gynecologist clearly taking the all the history assessment. She take all family histories and previous father side and mother side history, everything they are clearly taking, and they will make the pedigree, family pedigree chart. Okay, because possibility of the hereditary problems or mother related problems may be more common during the this period only they will roll out. Okay, suppose if they come to know there is a problem with this side, then we can call that is high risk pregnancy. Okay, we will study in OBG details on this. Next we'll see smoking. Smoking is definitely, so during the mother pregnancy, during pregnancy mother if smoke, definitely it is released to the IUGR, intrauterine growth retardation. It is also we can be roll out. Okay, so should not be encourage the mother who are smoking history in previously pregnancy, and she should be stopped during pregnancy. Okay, and use of drugs also one of the major problems. So unnecessary drugs should not be take during the pregnancy. If suppose take the drug, then definitely some antipsychotic drugs, they are defect on neural tube defect and other organs malformation, it might be problem. So you have to rule out this. You have to educate, because you are being a nurse, you know that with the what are the problems maybe happen during the pregnancy. So what are the health education, if you know very well, then only you can educate the parents. Okay, when pregnant mother. And factor related to the, that is factor related to the mother, it is a factor related to the fetus malpositioning in uterus. Sometimes the child is not able to proper position is not come, then it is malposition is a mainly severe problem during pregnancy. During delivery, if there is a malformation, that is one of the major indication for the cesarean section. Okay, cesarean किस लिए करते हैं, बेबी माल पोजीशन का वजह से, ब्रीच प्रेजेंटेशन रहता है, नहीं तो शोल्डर प्रेजेंटेशन रहता है, उस टाइम में क्या करते हैं डॉक्टर ने, दे विल गो फॉर द cesarean. Okay, otherwise normal delivery it may be. Suppose malformation का वजह से child is not able to breathe, meconium aspiration, there are many things may be problem. Fall to placental implantation. So this you people will studied in your OBG, means placenta is a lower uterine segment. In case of the placenta is implanted in other side of the uterus, so maybe it is a severe problem. We call this is a two types of problems we will see. First, abruption of placenta and placenta previa. So you will study in detail in your OBG. So this is a malformation of the placenta, and placenta abnormalities also we will see, like for example there is a suction-cherated placenta, that is mother is already anatomically problems with placenta, and there is a battered door placenta. These problems maybe the child is not get the adequate. What is placenta? What is placenta means what? Pallavi?
Give a nutrition to the baby by this.
That is one of the major organ to the barrier between the mother and the children. Whatever things you want through the placenta only, it will come to the children, baby, fetus. So that's why if placenta is abnormal, definitely child, the baby is not get the adequate nutrition. It may cause to the severe impact on growth and development. Clear? Next you see postnatal environment. So postnatal environment is very important, because a child is inside the uterus, they are getting a good ICU से ज़्यादा बड़ा रहता है उधर, क्योंकि everything is coming normal. I think oxygen capacity is normal, food nutrition also is getting very good adequately, and everything is normal, temperature, everything is. When the baby come to the external environment after delivery, it is come to the external environment. Okay, so here sometimes cold, sometimes infection, microorganisms, sometimes child is not get the adequate nutrition. This time postnatal period, child is start with the problems. Okay, intranatal to the child is very good environment. If mother is taking very healthy food and mother is very good health practice, that child is getting all the facilities. So that's why many children's neonates you see NICU, they are following very strict protocol. They are getting optimum temperature in the NICU, and they are warmer, they are keeping the baby, and they are getting adequate nutrition, and they are aseptic technique. No one is they are all the doctors, other health workers are wearing the mask, and Nowadays they are wearing masks. Before that also, who are entering the NICU, they have to change their dress. They have to go. When you come to the posting, this practical posting, when you post in the NICU, the doctors will not allow you to go like that. They will ask you to wear the dress and wear the apron, the plastic apron, and change your shoes, everything. That means we need to aseptic technique we have to follow in the this NICU. Why you have to follow this? What is the reason of this? Jagriti, she's coming and going. I don't know where she is, what she's doing. Huh? Jagriti Singh. I don't know, some
Sir,
student's name is,
it's a
yeah.
network problem. So network
Uh,
is coming and going, so it's showing.
okay. Why is we need to very aseptic technique for the this NICU children, means neonatal children, newborn babies? Why you have to maintain the aseptic technique, optimum temperature?
Sir, because infection chances are very much, their immunity is not well developed.
Yes, immunity is not developed. That's the main reason we have to take care of this all aspect. And hydration, because I told you yesterday, extracellular fluid is more in children. If extracellular fluid loss, child is goes in shock. That's why we have to correct the fluid immediately whenever children have showing dehydration symptoms. And in third one, temperature regulation system, hypothalamus is not developed. So that's why, and adipose, brown fats is very less, so that's why children maybe easily get the hypothermia. So these all should be ruled out. This is very important aspect. So you have to give the very optimal environment to the children. Okay. And next we see what are the external environmental things we'll see. So, and other things we can see socio-economic status of the family. So you'll see the what is the socio-economic, one family's socio-economic also influencing the child growth and development. If you have very good family income, they will take the adequate nutrition to the and regular immunization and regular antenatal checkup. It will help to improve the child growth and development. Child's nutrition is very important aspect. That's why government has given various nutritional programs for children. You already studied in community. The nutrition is one of the major aspect, because nutrition why is required is a very important, because growth and development take place. So that's why child is growing stage, we require the adequate nutrition. If not get the adequate nutrition, definitely child is not up to the mark what is expected weight and height. So India is, according to the, just I read one article, India is highest in malnutrition children, under 5 malnutrition children, highest in world. It means we need to rule out. That's why government is spending the crore rupees for these programs. Every month, every years, they are keeping this amount for the nutrition for children. That's why government is providing the school health programs in under programs. They are providing the food, free of food for school children's and Anganwadi children. So why they are giving? Because they make the correction of the nutritional malformation. It's one of the major problem in India because of the inadequate knowledge on nutrition, and children are not able to take the proper nutrition. So that's why, so nutrition program or nutrition is one of the major problem for the growth and development. Okay. Next you see the child ordinal position in the family. What is ordinal? In the sense, suppose a child is first child will give more care. For obviously in Indian culture, first child is giving more care, and second child and third child they will reduce the interest. So that is also one of the reason we have to treat the children equally. So that's why it helps to reduce the this imbalance. And number of siblings in the family. For example, there are many children's, there are already 2 younger brother, 3 younger brother, and there are gender bias also is more problem in India. There is a male babies get more protection and care comparatively female girl. Like that, that is siblings are more siblings, 3 or 4 members already in children's are there in their family, and then start neglecting of the children, other children. So this is a reason we have to balance. We have to educate the parents. That's why government have taken various initiative for this imbalance of the child care. Okay. Family structure. Many times there is joint family, nuclear family. Joint family give them more protection and more care comparatively. And come to the this other other like you come to the other areas where joint family, there the many people are not give that much care, and single parents, sometimes parents divorce, sometimes loss of parents, single parent is not able to take a working environment, and mother is working somewhere, that is also very problem. So these are the problems we can be see that these all should be educate and maintain the give the priority for the child care. Okay, this is also one of the major problem. I hope you are understanding what I am speaking, है ना? समझ गए ना सब लोग को?
Yes, sir. Yes, sir.
हाँ. So if there is any problem, just to let me know, and otherwise you can send message, and otherwise you read books. I think read nowadays is you getting various resources for the all the books you will get in internet. If you have any problem, just to type it what is you want, then definitely you will get. Okay. So
Sir, please share the PPT after class.
you read it, you read books, then I will. This is my I prepared them according to my knowledge. Okay, so there is many things I explained not in a PPT. Clear? You read it first. Okay, you read it, then you will see. You first read first, because I this is a whatever I prepare materials, that is according to my knowledge and my uh, according to my convenient. I put the some many points I did not put because already I know that this already I read 2 to 3 times books. Okay, so you read it, you spend time for reading, then only you come to know, and after that you can want I will discuss this, huh? Okay, now and internal environment, like a child is intelligence. I told you child intelligence is mainly depend on the hereditary factors also. Okay, hormonal influence, I told you hormones is very important, because hormones it may be helps to various organs. For example, growth hormone is a growth and development, some adrenal glands are emotion, stress, everything is a hormonal influence. Sometimes inadequate hormonal deficiency, maybe it is a major problem. Suppose they are not get the that is some fascicular stimulating hormone, ICTH. These hormones may be definitely is the impact on the growth and development of the genitourinary system. Okay, so reproductive system. These are the hormones may help you to influence the growth and development. And next, emotional factors also, because you don't think children are if suppose family is depressed, parents are depressed, divorced, definitely it will impact on the child growth and development. Okay, should not be show this is suppose the parents are in family family, all the families are not good in a relationship, intergenerational communication problem, there is a very stress in family, it is definitely affect on the child growth and development. You have to give the balance, all the balance environment to the children for the healthy growth and development. Okay, I hope I explained more things to you today. So you read, then only you come to know. Okay, I hope you people will read after your exams are there. I think you people are not, at least you just to see it today. If you get 1.5 an hour, just to go through it what we discussed, you just according to syllabus only I am discussing. And if you want to next class, I will once I will discuss all the syllabus, what are the topics. Already yesterday I told some what are the important things. This you this whatever I'm discussing according to your syllabus. Okay, so please you go through it. And types of growth and development, types of growth and development, I will stay this slide I will complete and I will stop it. Okay, so I will take attendance, and I think it's explain more, no issue, because you people get adequate time, because there is no clinical posting now, and nothing you have in home, and you spend, because whatever days in our spend already enjoyed, leave it. Now whatever you give you all the time for your study now. Okay, so types of growth, you see the physical growth, height, weight, head circumference, and already I discussed physiological growth like vital signs and everything. We will discuss what are the age, first month child, how much heart rate, newborn baby, what is the respiration, and how you can see types of development, motor development, okay, cognitive development, and emotional development, and social development. So growth we can already discuss the and development. Types of development we see the what is the motor development, what is the cognitive development, what is emotional development, and social development. Because some books has written but this development in different, but all meaning are same. Don't confuse with if which one you convenient, that book you can read. Okay, if you not get on internet also, you get the very good materials. Okay, so these things are important. You just read it, and as much as possible you can see. Okay. So we already is discussed this slide. What is the stages of growth and development? Okay, first prenatal, embryonic conception to 8 week, we call the embryonic development. Embryo you can call. Fetus you can call 8 weeks to 40 weeks. Already I told you up to 37 to 40 weeks called the normal gestational age. Okay, before 37 week we call the preterm baby, and after 40 weeks or 42 weeks we call the postterm baby. Okay, what is infancy? Infancy, it is a neonates, birth to 1 month we call the neonate, and infancy or infant 1 month to 1 year we call the infant. Okay, so neonates again you can classify early neonates and late neonates. Some books they have classified early neonates first 8 weeks we call, sorry, first 8 days, first week baby we call the early neonates. First week to 4 week baby we call the late neonates. Okay, next similarly infant is 1 month to 1 year, and early childhood again you can classify toddler 1 to 3 years. It's a very important slide. Just you have to read and remember always. It is only middle, I mean school age, toddler, preschool age only we can call, because and many students I seen student they don't know what is a toddler. Toddler, some examiner will ask what is a toddler. Toddler they are not able to answer the this question. Sometimes that they come to know. So that's why I'm telling you, please you can be ask, you remember this. It's very simple. Just read 1 or 2 times. You will print in your mind. Okay. Preschool, that is 3 to 5 years, and similarly for middle childhood, school age 6 to 12 years baby we call the school age children, and late childhood, that is adolescence, that is 13 years to approximately 18 years baby we call the this one. Okay, adolescence. Okay, these all come under the pediatric. This whatever changes take place physiological and psychological or any other developmental stages we will study in pediatric. Okay,